Hello, my name's Tiffany. I'm a dental hygienist, and today we're going to talk about manual toothbrushing. Often manual toothbrushing gets a bad rap because it isn't an electric toothbrush, but I'm here to tell you that toothbrushing, even if it's with a manual toothbrush, can be really effective at cleaning plaque off the teeth to ensure that your teeth and gums stay healthy and strong lifelong. In this video, I'm going to talk about the common mistakes that I see from people, meaning that there's areas that everybody misses when they're brushing. We're going to review tweaks to the technique to make sure that we aren't missing those spots. I'm also going to brush my teeth on video just so that you can see exactly what I do when I'm using the manual toothbrush. Bacteria everywhere loves sheltered environments, areas where it can grow without being disrupted. And so in the mouth, those areas are often between the teeth and underneath the gums. And so using our toothbrush in a way that is going to allow for our bristles to really wiggle up under the gum line is the best way to disrupt that bacteria. Let me show you how. I'm going to position the bristles of the toothbrush not flat against the tooth and not vertically along with the tooth. We're doing it at a 45-degree angle right at the gum line. Think about your toothbrushing as being half tooth, half gum. For me, I'm going to start on my upper right corner. Slowly use a vibratory stroke that gives each tooth and gum a couple seconds of attention, and then inch our way around all the way until we get to the front teeth. Then we'll flip to go to the other side, and we'll work our way to the back over this way. All the way to the very back as far as you can reach. We're going to tuck the toothbrush onto the inside of the arch. We're going to do the same thing, angling the bristles up to the gum line and work your way slowly to the front and into the other side. And then we're going to do some scrubs on the tops of the teeth. These are areas that generally get quite a bit of the natural cleansing from your chewing, but still important to give them a good scrub. Then we're going to go to the bottom. We're going to do the exact same thing on the lower as we just did on the top. So there's three really common areas that I see get missed with toothbrushing in cases. And I know this because we use this purple dye that stains the plaque bacteria, and it highlights areas that are purple, meaning that the bacteria there is more mature, it has been there longer, because likely we're missing it with our toothbrush. A general rule is that typically people are missing the gum line. They're not brushing close enough to the gums. But these three spots are specific spots that I want to point out to you so that you can be mindful of it when you're brushing. Spot number one, the corner of your dominant hand. So whatever hand you're brushing with, for me it's the right hand, this corner is always going to be a harder spot for me to brush. Here's why. This is easy to brush, way in the back here. As we come forward, we flip to go to the front teeth and easily work our way to the back here. But this corner is like really awkward to get here. What I want you to do is, instead of thinking back teeth and front teeth, think of brushing your teeth in quadrants. And so that means that we're not gonna flip the handle of our toothbrush until we're done brushing right to the middle here, where then we can flip this way. That's gonna ensure that you get this right corner, or left if you're a lefty. Spot number two that I often see people miss is the inside of the lower teeth, the back teeth. Probably because the tongue is in the way. It's important to think about getting the tongue out of the way to get the toothbrush in there. But one more thing I want to point out to you is that it is really common for our lower molars to tip inwards slightly. And so when we're brushing, we need to be sure that we're actually pivoting the toothbrush to make sure that these lower bristles are touching at the gum line. It's a common spot that people miss, and it takes practice to figure out the proper technique. Spot three of where we commonly miss when we're brushing is actually the outside of the upper molars. When we go to brush those back teeth, we often try to open as wide as we can to make more room in the back for a toothbrush. But what happens when we do that is the cheek gets really tight, and this jawbone gets in the way, and it fully blocks our access to get back to the cheek side of those upper molars. I can't get back there. And so here's the trick. If we close our jaw together part way, and then we shift the jaw towards the side that we are looking on. So slide your lower jaw to the right side if you're brushing your right molars. It actually creates this wide opening back there for your toothbrush to fit. And I want you to envision that you're trying to wrap the toothbrush kind of around the back corner of that tooth. Go easy on yourself back here, because I bet you it's an area that's been missed, and so the gums often have quite a bit of extra inflammation back there. After a couple weeks of thorough brushing, you're going to notice the gums are tougher, there's less bleeding. Those are both signs that the gums are healthier. I just love seeing cases that look like this that 6 months later when I see him again, look like this. If this video has been helpful for you and your manual toothbrushing, any interaction, whether it's liking, commenting, or subscribing to my channel, helps to ripple the reach of the information within it. Thank you for being here and have a really wonderful day.